Hello there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about blood products that are for the prevention and treatment of severe bleeding. Platelets, fresh frozen plasma, FFP, and cryoprecipitate are vital blood products for neonates, but serve different roles in the prevention and control of bleeding. Let's break them down one by one. First, platelets. Their purpose is to increase platelet count and stop bleeding in thrombocytopenic neonates, typically given in aliquots of 10 to 20 milliliters per kilogram. Platelet transfusions are often used cautiously due to risks and complications including inflammatory response. Transfused platelets release cytokines that increase inflammation, harming the brain's white matter, lungs, and intestines, contributing to NEC, sepsis, and lung disease. Platelet transfusions are associated with higher rates of death or severe impairment, cerebral palsy, cognitive deficits, in extremely preterm infants. Additionally, in some cases, platelet transfusions can paradoxically worsen or cause new intraventricular hemorrhages. Evidence from trials suggests using lower transfusion thresholds, such as less than 25 micrograms per liter, for non-bleeding preterm infants reduces major bleeding and death. Therefore, careful consideration of the infant's specific condition, active bleeding, surgery, is crucial before transfusing. Next is fresh frozen plasma, FFP. Purpose is to replace all clotting factors, except platelets, when there's a generalized coagulation deficiency, such as in severe liver disease. Typically given in aliquots of 10 to 20 milliliters per kilogram. They can be less efficient than cryo for fibrinogen, and carries higher volume load. FFP is composed of plasma containing all coagulation factors, 5 and 7 through 12, as well as fibrinogen. Key risks and complications of FFP include volume overload, transfusion-related acute lung injury, allergic reactions and febrile reactions, thrombotic events, hypocalcemia, and a small risk of bacterial or viral infections, like CMV, though reduced by leukoreduction and seronegative screening. In essence, FFP is a powerful tool, but must be used judiciously in neonates due to their unique vulnerabilities. Lastly is cryoprecipitate, cryo, whose purpose is to provide a concentrated source for specific deficiencies. Is composed of an insoluble precipitate from FFP, primarily fibrinogen, factors 7 and 13, and von Willebrand factor. It is preferred for hypofibrinogenemia in DIC, liver failure, or massive hemorrhage because it delivers needed factors in a very small volume, ideal for preterm or low birth weight infants. Key risks and complications of cryoprecipitate include volume overload, but this is reduced as the typical volume of cryo given is 5 to 10 milliliters per kilogram. Additionally, because a single aliquot of cryoprecipitate is pooled from several donor units, there are increased risks of infection as well as anaphylaxis, allergic and hemolytic reactions, graft versus host disease, and alloimmunization. Thus, CMV negative or leukocyte-reduced products must be used in all neonatal donors. In short, be sure to obtain informed consent, be thoughtful about transfusing blood products, and choose wisely. Be sure to like and subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.